The gluteus medius is another of the three gluteal muscles, and it is often called the deltoid of the hip joint because it has a triangular shape. If we find the ASIS here, and the iliac crest here, and the posterior superior iliac spine in back, then the gluteus medius attaches proximally all along here, runs distally to attach to a point on the greater trochanter here. Hence, it is like the deltoid with anterior fibers, middle fibers, and posterior fibers. The middle fibers are superficial. To palpate them, I find the midpoint of the iliac crest. I drop just off it distally between the iliac crest and greater trochanter, and then we ask the client to abduct the thigh at the hip joint straight up into the air against the resistance of gravity. And now we can strum perpendicularly across these fibers until I find the border of the gluteus maximus posteriorly. Here. To palpate the anterior fibers, it is difficult to discern them from the overlying tensor fasciae lati, TFL, especially in this client because his TFL is so well developed. To attempt to palpate these anterior fibers, we can either try to push under the TFL, or we can ask the client to immediately rotate, abduct and flex the thigh at the hip joint, and then we can try to palpate the anterior fibers here, but again, it is difficult to discern them from the fibers of the TFL. To palpate the posterior fibers, we palpate posteriorly and ask the client to laterally rotate, extend a bit, and lift the thigh up into abduction. However, it is also difficult to palpate the posterior fibers because it is difficult to discern them from the fibers of the gluteus maximus here.